Chronic heart failure is the inability of your heart to effectively pump blood around your body and affects over 500,000 people in the UK alone. So what causes it? And could treatments lie in something as simple as iron? Dr. Paul Carla is a cardiologist from Portsmouth Hospital, and he gave Chris Smith the lowdown.
In the Western world, the commonest cause is ischemic heart disease, which is a problem with the blood supply to the heart, so problems such as heart attacks. And in those situations, there can be irreversible heart muscle damage. But there are other causes. High blood pressure can cause it, even viral infections. And what we're also better understanding is that there can be a genetic predisposition to developing heart failure.
If I had heart failure, how would I know? What symptoms would I describe to you as my doctor?
The typical symptoms are shortness of breath. Patients may also complain of swollen ankles. Many patients have impaired quality of life and struggle to do day-to-day tasks such as going upstairs, going to the shops. In addition, patients frequently are hospitalised due to heart failure. So in England alone, there's around 70,000 admissions for heart failure per year. And if a patient's admitted with heart failure, there's around about a 1 in 7 chance of either dying during that admission or in the first 30 days afterwards.
What are you trying to do to change that?
So around 50% of patients with heart failure have an inability to use or absorb iron effectively. And low iron in heart failure is associated with a worse prognosis and greater symptom limitation. And we're conducting a study replacing the iron intravenously to see if it can improve prognosis in terms of death and hospitalisation.
Why do heart failure patients have low iron?
When people have heart muscle impairment, there are many other areas of their body that work inefficiently, and the inflammatory immune system becomes overactive. And there's a peptide, a protein produced by the liver called hepcidin that seems to interfere with the absorption of iron across the gut wall, but also it interferes with the body's ability to use iron from its stores. And iron's not only important in terms of hemoglobin, but it's also vital for mitochondrial function, which is the powerhouse of all cells and produces the energy for cells to function.
These people therefore suffer a double whammy, that they might have not enough iron to make hemoglobin for their red cells, so they may not be very good at getting oxygen around their body. And because the iron is crucial for the workings of these mitochondria, the things that make energy in our cells, if they don't have enough iron, then the cells can't make enough energy either.
Absolutely. There have been some small-scale studies to date that have looked at treating people with intravenous iron to overcome these abnormal pathways that prevent the usual absorption and utilization. And at least in the short term, it seems to make people feel better and be able to walk further. We're building on that to get a large-scale study of 1,300 patients in the UK, around 50 sites, and we're looking to see whether giving intravenous iron over between 2 to 4 year period is associated with making patients live longer and stay out of hospital.
How are you going to do the study?
The study will be conducted across around 50 sites in the UK. Patients will be recruited when they're hospitalised with heart failure or soon after a hospitalisation. The study is what is called a randomised study, whereby, effectively on the flip of a coin, patients have a 1 in 2 chance of either going into the treatment arm, where on top of the best treatment we can give at the moment, they'd receive intravenous iron, and then the other groups would receive best quality care alone.
So you're looking at whether or not what people end up back in hospital with another case of heart failure, or unfortunately they die, and asking, does that happen more often in the group who don't get the iron?
Absolutely. And in terms of changing international practice, those are the sort of data that are required to raise the awareness of this problem and show that it's the right way of treating people in the long term.
And if it does work, do you think there will be a case for saying, well, can we keep people out of hospital in the first place by giving them extra iron in the community, something their GP or the district nurse could do?
I think there's a role for looking for iron deficiency early in the disease course, and as well as optimizing patients' care for all the drugs that we know that work, then iron would become a component of that. And whilst initially we spoke about some of the adverse prognosis with heart failure, what we do know is if patients can be got into the right system and onto the right drugs, actually the outlook for them can be much, much better.